The family of a local veteran who lost his life to COVID-19 is speaking out tonight. They are pleading for others to take this virus seriously.
Come on, come together and give us small businesses some help.
Plus, Washington's COVID-19 restrictions have forced many businesses to close their doors now for the second time this year. And now some gym owners say without government assistance, those doors may stay shut permanently.
Mostly dry conditions now across the inland Northwest, and I'm tracking sunshine for Friday. That and a look at your weekend forecast next.
Just wanted you to know I tried real hard, but the is really strong.
Well, this is Navy veteran from Davenport recorded a final message for his family before losing his battle to COVID-19 back in October. He tested positive in September and experienced symptoms for several weeks. Good evening and thank you for joining us. I'm Mark Hanrahan.
Welcome, everyone. I'm Whitney Ward. In an interview with our Amanda Rowley today, his family is now begging the community to please take this virus seriously.
The coronavirus continues to take away our loved ones. On October 14th, it took Alice Roseborough's partner, Gene Plackmore. He died at the age of 68 after fighting the virus for several weeks.
If you're listening to this, I might be gone already.
Gene recorded this final message for his family while at Holy Family Hospital. He wanted to share his battle with COVID-19.
She says I'm at 92 oxygen, which is real good.
I don't think anybody has ever televised themselves when they're sick with his COVID, and he did. And I thank him for that.
Gene tested positive on September 14th. Nurses believed he contracted it a week prior.
How do you think your husband contracted COVID?
I don't know. There was a couple of days that he'd gone to Safeway, and not everybody down there had been wearing a mask at that time.
Did your husband wear a mask frequently?
All the time, yes.
Alice says Gene isolated himself at home when he first experienced symptoms.
As the days passed on, he was coughing really, really horrible, and times when you just knew it was going to be his last breath.
His cough got worse, and he had trouble breathing. That's when he drove himself to the hospital.
I just felt that when he left me that day and went down the front steps to get into the ring, that might have been the last time I would see him.
I'm struggling the best I can and doing what they're telling me to do.
He recorded this video just before his second intubation. Then he got worse. His blood pressure dropped dramatically and his kidneys began to shut down.
Alice, can you kind of talk to me about the challenges and how difficult it was for you to not be able to go and see your husband in person for that time?
Well, all we could do was pray.
She says he lived a full life as a musician, Vietnam War Navy veteran, and a family man.
He touched a lot of people's lives, and he was a good father, a good grandfather, and a friend to all.
Still grieving the death of her partner, Alice is begging the community to do their part so this nasty virus won't take another soul.
And I want his story to go out to the world to let them know that this is serious and people are dying from this, and they need to take it seriously.
Amanda Rowley, KREM 2 News.
Well, my goodness, our thoughts certainly go out to that family and thank them for sharing that awful story. Whitney?
His video is incredible, and she's right. People don't usually put themselves out there in those kind of dire situations, but it's a powerful message, and I think it's one that we absolutely need to be hearing right now and paying attention to.
Exactly right. Well, to tracking the coronavirus now, another day with staggering number of new cases here in Spokane County. 414 new cases reported in the county today. That is the second biggest single day spike. 4 new deaths were also reported. 120 are currently hospitalized, 90 of which are county residents. There are more than 13,800 cases to date in Spokane County. The county recovery rate stands at 65%.
And as those hospitalizations also continue to surge, healthcare facilities like Providence and MultiCare are working overtime just to make sure they do have enough capacity to care for all of these patients. I had a chance to speak with the program manager of the Sacred Heart Special Pathogens Unit. Spokane, of course, is the only one in this entire region with that kind of highly specialized unit for contagious patients. It was built about 5 years ago with grant funding, and at the time they had no idea how much they would eventually need it.
I think, we all thought 5-6 months ago there would be an end in sight. And right now, I think as our cases are higher now than they've ever been, it's just a level of fatigue that we really sense amongst all our healthcare workers.
At the beginning of all of this, that the main goal was to try to keep that curve as flat as possible so that it wouldn't overwhelm the healthcare system. Are you worried about actually reaching capacity to where we are starting to overwhelm the local system?
That was one of my biggest questions to her, and I'm anxious for you to hear her response. You can hear the rest of our conversation. That's coming up tonight on KREM 2 News at 6.
Face masks are once again required in North Idaho, and this time not just in Kootenai County, but across the entire Panhandle Health District. This comes after Health Board members voted to rescind the mask mandate last month. The Health District reported 189 new cases of the coronavirus just minutes ago. Let's get right to KREM 2's Taylor Vito, who's been tracking this story all day. He brings us the latest from Kootenai County today. Taylor?
Well, yeah, Mark, it's been a little bit of a roller coaster ride in terms of the mask mandate and Panhandle Health's board. But on a 4-2 vote this afternoon, they opted to bring the mandate back, but with a big change. More on that in a moment. But during the meeting today, some spoke about the rising case numbers here, while others who were against the mandate questioned COVID-19 data and if a mandate was the right thing to do.
It means a tidal wave is coming. That prediction is based on the data.
That was the voice of Panhandle Health Board member Jay Nelson as she made a pitch for a widespread mask mandate to come back to North Idaho. Health experts have said that the coronavirus positivity rate across the Panhandle Health District, which encompasses the 5 northern counties, is over 17% and is rising. Kootenai Health has previously said that their employees are strained and they're concerned about hitting capacity. Like before, the mandate discussion brought some debate. Protesters could be heard chanting outside of the meeting. Other board members who opposed the mandate questioned COVID-19 data and if a mask mandate was morally right.
Jay, it sounds like a lot of good scare tactics, but I disagree with the mandate saying you will under penalty of law. That to me is totally wrong.
In a reversal from last month, the mandate eventually passed on a 4-2 vote. The new mandate, as proposed by Nelson, now applies to all of the Panhandle Health District, not just Kootenai County like before.
It's our job to provide courageous and steadfast leadership in a public health crisis. It's our job to save lives.
The mask mandate situation was somewhat scattered before in North Idaho. Coeur d'Alene, Wallace, and Kellogg all had mask requirements. The city of Post Falls recommended that people wear masks, but only required them on city property. To the south, in the North Central Health District, Moscow requires face masks as well. Now, like before, the mask mandate is technically a misdemeanor, so if you break it, there could potentially be some penalties. But it's worth noting that authorities across North Idaho have mentioned throughout this whole pandemic that they're taking an education before citation approach and that they're trying to just educate people rather than handing out tickets just right out of the gate, so to speak. And it is worth pointing out that any kind of citations in North Idaho related to anything COVID-19 have been pretty rare. In Kootenai County, Taylor Vito, KREM 2 News.
All right, Taylor, thank you so much. As we shift gears now to weather, the sun is setting. Actually, it just went down. We had a really beautiful sunset this evening. More sunshine, clear weather, it sounds like, for maybe the rest of the week. Meteorologist Tom Sherry is in now to let us know when things might start changing again. Tom?
Yeah, I think we've got a couple of nice days in front of us, but, chilly at night. You'd expect that in November. We're going to drop down below freezing tonight, and we'll see below freezing temperatures over the weekend as well. But a pleasant Friday as far as sky cover, lack of cloud cover is concerned. And I think that will continue into Saturday. Right now, partly cloudy skies in the Spokane area, current temperature of 40 degrees. As you can see, we take a look at the satellite and radar pictures. Still have some snow showers over in some of the higher elevations of northern Idaho as this system moves kind of from west to east, but mostly east of the Cascades. We're just seeing some dry weather. Again, you can see some of the snow showers as you get it more into like I-90 towards Shoshone County, eastern Kootenai County. That's where we're seeing some of the showers, and we had a little bit of rain kind of along the Washington-Idaho border down into the Palouse as well. So your day planner forecast goes like this. Partly cloudy this evening. We'll see an overnight low of 40 degrees, and then tomorrow we'll start out with clouds, but then I think the clouds will dissipate, and we should see mostly sunny skies, and we'll look for a daytime high of 45. We're getting closer to the weekend, friends. Here's how it looks. Again, mostly sunny on Saturday with a high of 42. Cold at night, though. And then Sunday, increasing clouds. We'll see a daytime high of 40. I'll check the rest of your 7-day forecast coming up in a few minutes.
I love it when we get some sunshine even when it's cold outside.
Absolutely.
Good stuff. Thank you very much, sir.